Hey everyone, my name is Allie Nelson and I am a physical therapist and I work in a clinic south of Denver. I am currently an orthopedic resident of Upstream Rehab Institute and I'm going to be talking a little bit about patellar dislocations. So first I want to talk about immobilization. There's a variety of factors that go into this. First I want to talk about how long a patient should be immobilized. The Adductor protocol specifically will only immobilize for 24 hours. I've seen that some will go up to also about 4 weeks, and some will depend on how long it takes for the quad to be functional again. The position of immobilization will vary. I've seen the Adductor protocol, that I will also link below, will immobilize in 120 degrees of knee flexion. However, the most common is about 20 to 30 degrees of knee flexion. And I've also seen full knee extension. Most will say that full knee extension is what is most functional. However, when a patient is in full knee extension, the only restraint is the soft tissue, and the MPFL is actually in the most elongated position. Having about 20 to 30 degrees of knee flexion actually assists with having the patella in the trochlear groove. The Adductor protocol also talks about how short-term immobilization is actually better for the patient due to a variety of factors. First being hemarthrosis, which could be painful, limit range of motion, and it could develop adhesions. The prolonged immobilization also will refer to muscle atrophy and will actually take a lot longer for a patient to recover if they are immobilized in a long period of time. Next, I want to focus briefly a little bit about what rehab will focus on. First, a lot of therapists will start with quad strengthening. The quadriceps is what helps with the patellofemoral tracking. Basically, what we're looking for is we want to make sure the patella is actually tracking appropriately in the trochlear groove. What happens commonly is that lateral subluxation when there is abnormal tracking of the patella. So focusing on quad sets first is very important. Then, it's important to look at adductor strengthening. So as we know, we can't isolate the VMO, but we can work on strengthening the adductors. Keeping the adductors strong is what helps in terms of keeping that patella from tracking laterally. If our lateral structures are tight, then it's going to continue to track laterally, so we want to make sure we strengthen the medial structures, so again, our patella is tracking appropriately. Next, it's important to look at the hips. Do not forget to look at this. I will personally say that this is one of the faults that I had when I was first treating my patient. So if you think of this, many adolescents have impaired proper biomechanics when it comes to squatting. What you will see is hip and knee valgus adduction internal rotation. So basically they dive in whenever they go into a squat. Why does this happen? We all know, if we had to think about it, it's because of glute med weakness and hip abductor weakness in general. So it's important that we also focus a little bit on hip strengthening, as that will also help in terms of having the proper biomechanics, but then also helping them when they return to that functional sport. Following that, the fourth thing will be proprioception. So the MPFL is actually innervated. So depending on if the patient had surgery or not, we still want to make sure they're getting that proprioceptive input. If you think about how much dynamic stability an athlete needs, this is super important to get back. Then it's also important to continuing that proprioception area is to look at core control. So if we have decreased core control, then we're also going to have compensation within the hips and the knees, and it could go down to the ankles as well. So making sure that they have a functional core is super important.